Coronavirus cases outside of China continue to grow exponentially, but good news, kids seem to be spared. Hello everyone, this is Chris Martinson here with your COVID-19 update for February 18th, 2020. I'm going to title this one, What's Going On in the West? But before we get there, first the numbers. All right, let's take a quick peek here, and I don't trust any of these numbers out of China. What can I tell you? Going by their numbers, it looks like containment is working if you trust their numbers. I believe that the kinds of containments that we have been seeing in China should be absolutely slowing down the rate of spread. But listen, China may have underreported this by a factor of 10 or more at the outset. So we really don't know where those numbers are. I think the Diamond Princess cruise ship, the plague ship, is giving us a pretty good handle on exactly how transmissive this thing is. This is really beginning to support the idea that this virus spreads through aerosol transmission, which we're pretty sure of, but we're just sort of continuing to confirm that as these cases come up. And now we're up to 20 in serious or critical there. Good news, Singapore seems to have slowed down a little bit. There were 8 at one point on serious or critical, but all 4 of these are in critical, so I wouldn't be surprised to see deaths showing up over here. Japan, to me, is the country to watch. It looks like they are now well on their way. They're going to surpass Singapore, I would imagine, here. 8 new cases. We'll be talking about those in a second. And it's really starting to look like Japan is going to be the place where this is going to blow up next for a couple reasons. All right. The next 2 weeks are going to be really, really critical in this story. And I've said that before, but now we've got a bunch of data to support that a little bit further. We see South Korea now, 1 new case of the coronavirus. This is with a woman who has no travel history. Just where did this come from? Picked it up somewhere along the way. And so this really speaks to the idea that there is are other cases in South Korea that are yet to be detected spreading. And the way of this, and I'll show you a chart in a second, the way that exponential increases in something like a disease like this go, it's pretty slow at first. 1 case, 2, 4, stuff like that. But when it gets going, it really gets going. So we're going to have to keep an eye on what's happening in South Korea. Singapore, 4 new cases of the coronavirus, 5 others released from the hospital. That's very good news. 4 people, as I mentioned, in critical condition. And again, these cases are not showing any clear link back to China and travel to China. So again, it looks like it's endemic in their country, so they have a local epidemic now, and we'll just have to see how fast that goes. But let's go to Japan, where I think we're going to see this thing really break out and make the biggest trouble going forward. I think the next few weeks are going to be very hard in Japan. We have 23 people now with coronavirus in Japan that are seriously ill, according to the country's health minister. That includes 20 people from the cruise ship, 3 in Tokyo. 7 new cases of coronavirus. Again, all these saying 1 hour. These were all done, located. All this news was located today on the 18th. 3 in Tokyo, 3 seriously ill. 22 there, but 3 new in Tokyo. 1 way out in this prefecture, 1 out in this prefecture. There's information coming in now that potentially the cruise ship itself is a source of some of these infections, because people who are going there working on the cruise ship were then taking off their PPE, their personal protective equipment, and then getting on buses and trains and going home. So that could be a source of what's happening here in Japan. This coronavirus, seems to not only travel really easily, but survive pretty well on the outsides of things. So here, seeing finally on CNBC, on Squawk Box here today, saying Japan appears to be on the cusp of a large outbreak and maybe epidemic growth in Japan. We need to watch that very closely. Former FDA Commissioner Scott Gottlieb. That's actually, so we're starting to see this truth begin to break out a little bit. Now, a lot of people have asked me, and I've also been puzzling myself over this idea of where are all the cases outside of China? Why haven't they really taken off? And there, I think we're going to have to take a couple of views on this. The first, there may well be a lot of cases out there that are not being detected, and I'll get to why that is in a second. And some of it's just because, well, you know as well as I do, this thing is asymptomatic potentially for a long time. Very difficult to detect when it's asymptomatic and resident out in your population. But the other thing is, let's just look at the data here. And so this is a chart that a member Tom Sammy at Peak Prosperity, one of our people there, put together this handy chart of all cases outside of China. So thank you, Tom Sammy, for that. And this is as of February 16th. You can see the shape of this blue line here is really starting to pick up. And that's starting to look a little bit exponential. That has that curved shape. So even though it feels like there aren't a lot of cases outside of China, in fact, the shape of this chart suggests maybe we're just at the early stages of an exponential growth across the world. And in fact, today is the 18th, so let's true this up for February 18th. We now have 999 confirmed cases outside mainland China, allowing me to just sort of draw this green line on here to extend this chart. So I think you can see the shape of that curve that we've got there. The next couple of weeks are going to tell us if we're right or not. The doubling period on this is about every 6 to 7 days. So given that, we would expect to see this at 2,000 cases by, well, let's call it a week from now, and it's the 18th. So by February 25th, if we have 2,000 cases, this chart will be way up here somewhere, and we'll still be on that exponential phase of the growth of this particular virus. All right. Let's look at the cruise ship again. Wholly inappropriate quarantine practices may have helped spread coronavirus on the Diamond Princess cruise ship. Experts say. Let's listen to these experts a little bit more because I think they're onto something. Absolutely the case that whatever we were doing to try and quarantine or whatever they were doing to try and quarantine really wasn't working. And I heard reports, I couldn't confirm them, but somebody said that one of the couples that has been broadcasting their experience from the cruise ship, a British couple, had filmed a noise outside of their room and saw that people in full hazmat suits were out there taping plastic over a vent. And you would only do that if you thought that this stuff was traveling through the vents, and you would only do that if you thought it was aerosolized at that point in time. So I think this wholly inappropriate was because they didn't appreciate that this thing is aerosolized, and that's a giant problem in this particular story. All right, here's where I think we are in this particular story. All truth passes through 3 stages. First, it's ridiculed. Second, it's violently opposed. Third, it's accepted as being self-evident. Thank you, Arthur Schopenhauer. Stage 2.9, just before you get to self-evident, that's when the toilet paper all disappears. I think that's what the officials are really trying to do, is to keep the concern about this down. They want people not to go out and rush out and prepare all at once in a hurry and hoard and do all those things. I get it. I totally understand what the public health officials are up against. But there's some magic thing that happens in a culture between something being really ridiculous or stupid or even something that makes you mad to all of a sudden people accepting it as self-evident. And when that happens, that's where the race is on. And I think that's what they're trying to keep us down here in this confused stage, is how I'm reading a lot of the things going on out there in the media. Money can't fix everything. I'm watching, Walmart is up today and the stock market is green very handily, despite having really horrible earnings. And probably you can't make a strong case for Walmart being really solid from this point forward based on the coronavirus. But it doesn't matter, because in the market has been conditioned by 10 years of this idea. The market is taking coronavirus in relative stride. Relative as in making all-time new highs on a repeated basis for the past couple weeks. Because if things get worse, well, we're going to have more quantitative easing before you can blink. And that's what Jeffrey's saying there on CNBC, macro strategist. And on the other side, we have China's EU ambassador says, impact of coronavirus epidemic on Chinese economy is limited, short-term, manageable. None of those are terms that I would actually apply to shutting in 90% of your production all at once for a number of weeks, if not months, depending on how this plays out. And the EU ambassador went on to say there's no need for global investors to worry too much. Thank you, EU ambassador from China, helping to make the rest of the investors in the world feel comfortable about their stock holdings. Chinese government has sufficient resources to boost economy. This is really rooted in the idea that money can fix all things. And that's an old idea that's rooted in the past 10 years. And it really was working for a while, but we have to question whether that's a viable thing, whether that's an appropriate sort of a framework to be holding at a time when we're seeing global supply chain disruptions. And by the way, QE can't do anything about a shortage of car parts, so cars can't get built. It can't do anything about a shortage of circuit boards, capacitors, and other integrated components that go into manufacturing. something. It can't do anything about fixing real things that are happening on the ground like that. All right. Hey, good news, though. New York Times just posted today on 2/18 that they finally caught up to some of our numbers, and I'm very glad to see that finally. And so, here they are. They're looking at this, an analysis of 44,000 coronavirus patients in China. So it was a big analysis, came out. They poured through it, took a look at it, and they're looking at a fatality rate of 2.3%. And then they note that in the United States, flu fatality rates hover around 0.1%. And so that would make it 23 times, 23x deadlier than the flu, if you believe that this is the actual correct number. So it's good to see finally the New York Times catching up with that, and congratulations on that. And this is continuing from that same article, and noted, again, it's either mild or deadly, right? Overall, 81% of patients with confirmed diagnoses experience mild illness. Some of them, I think, won't even know they're sick at all. They'll be testing positive for this thing, but won't actually even notice any symptoms. But 14% had severe cases, 14%. And that's the same number we got off the cruise ship the other day. So maybe that's the correct number there. We're starting to hone in on that. So 14% have severe cases, and about 5% come up with a critical illness. And so that's 5% of the total, 14% of the total. Mostly, it's pretty well spread across the age stratification. 30% of those who died were in their 60s, 30% were in their 70s, 20% were 80 or older. So that's 30, 60, 70, 80%. So the other 20% were 50s, 40s, and on down. And of course, patients with underlying medical conditions such as cardiovascular disease, diabetes, things like that, they died at higher rates. They noted the most important thing, the thing that I keep harping on, which is that the fatality rate among patients in Hubei province, the center of the outbreak where the hospitals were completely overwhelmed, was more than 7 times higher than that of other provinces. So this is really a tale of two states. State one, you're in an intact, functioning, underwhelmed hospital system, and the death rate is kind of pretty low. I would think it's probably even below that 2.3%, because that includes the Hubei province data. Or you're in a country that has very poor medical systems in the first place, and or your country's medical system gets overwhelmed by an absolute flood of patients, and then your fatality rate scoots up a lot, 7 times higher. So that's why we have to get the data out. That's why people need to be informed. That's why people need to know about how and what they can do to prevent the spread of this, and the communication of it from within their own households. All right. I'm still puzzled by this USA with just 15. It's been stuck at 15, I think, for 5 days now. Australia, same sort of a story, just stuck there. Vietnam, I'm not sure about these numbers, and I just want to point something out. It's the information came out a few days ago, story. 5 U.S. cities now are going to start testing patients with flu-like symptoms for coronavirus. So that's February 14th this comes out. So doctors in 5 cities will begin testing, I don't know when that begins, testing patients with flu-like symptoms for the new coronavirus, the CDC said on Friday. The test will only be given to patients who test negative for the flu. Okay, that makes sense. The flu tests are pretty cheap and easy. So far, the testing protocol will be implemented in Chicago, LA, New York, San Francisco, Seattle. So we got 3 West Coast cities, 1 in the middle, 1 on the East Coast. All right. More cities will be added, and it's a sign the U.S. is broadening its surveillance of the illness. Yeah, it's a sign. But I think there should be testing in 50 cities, 1 in each state. That would be a great way to do this. I'm not sure, are they too expensive to administer? I'm not really clear why you wouldn't just begin mass testing, just to be sure, because, again, what you need to understand is that the first way that you stop a spread of a pandemic is you have to catch the cases early as you can. All right. Just made me think of this meme that I came across, Eddie Murphy tapping his forehead saying, you can't have an epidemic if you don't run any tests, right? All right, moving on. I ran across this YouTube video here. Here's the link to it right down here. North Korean television just nailed it. This is North Korea. I didn't expect much, but they actually went through COVID-19 and ran through the whole thing. In this screen grab right here, they're talking about, and very helpfully showing you all the ways that you can catch this, said in addition to mobile phones, keyboards, faucets, and other things people commonly use in their daily lives can be the pathways for indirect transmission of viruses. And then they went on to go and talk about the more direct transmission, the ways that this passes through the air, ways that it goes into lungs. And then this video in just 6 minutes went on to discuss all the different symptoms and what they look like and feel like, deaths by the different age categories. They talked about the cytokine storm and how it actually operates. They noted that it's 50 times more deadly than the seasonal flu, which is a reasonable guess. And this video stresses the importance of everyone knowing the symptoms and methods of stopping the spread, and that everyone should wear a face mask because, of course, you don't know who has it and who doesn't, who's symptomatic, who's asymptomatic. So if everyone has a face mask, then those who are capable of transmitting it will do a lot less of that because of the face mask. And then this video went on to demonstrate the proper hand washing technique and actual, real people doing it and actually showing you the whole 20 seconds that you need to scrub. Did all that in less than 6 minutes. That was on February 7th. So that was, 10 days ago now or 11 days ago. Meanwhile, in the United States, this came out yesterday in USA Today. The top disease official, risk of coronavirus in the United States is minuscule. Skip the masks. Just make sure you wash your hands. This was Anthony Fauci here, director of NIAID. And it's really just downplaying this whole thing. Short of that, Fauci says, skip the masks unless you're contagious. Well, how would you know if you're contagious, Anthony? Come on. This is asymptomatic. How is this even a thing on February 17th that you don't know that, right? And don't worry about catching anything from Chinese products, and certainly don't avoid Chinese people or restaurants. So his main concern is that we don't offend anybody, I guess, or something like that, rather than properly addressing the concerns and properly taking people through what I think would be reasonable precautions. All right, skip too far ahead there. Let's jump back. CNN, yesterday, I gave them kudos because they finally put coronavirus up front. Today, let's go through. None of this stuff is coronavirus here. I guess we got to go further down. It's none of this stuff. Here's some stuff on the coronavirus right here, talking about the hospital director who died. Shanghai, China, what it looks like is coronavirus. Fears linger. It's not actually a fear if it's a legitimate concern that you're going to catch something that's really fatal and unpleasant. I wouldn't call that fears, but we like to call them fears here in the United States. Something about Tom Cotton, the senator, playing dangerous game with his coronavirus speculation, and China is monitoring everyone who bought fever medicine who bought it. It was actually an interesting story about that, finding out what a surveillance state can mean when a disease comes in. That's the United States. Meanwhile, in Italy, I pulled this off of Italy's equivalent of the CDC site and the Ministerio della Salute. Anyway, they have a bunch of questions down there that they're answering. Question number 7 is, how dangerous is the new virus? Look what they say here. Like other respiratory diseases, yeah, it's just like other ones. Other ones, like the cold you get, it's just like other ones. New coronavirus infection can cause mild symptoms such as a cold, sore throat, cough, and fever, or more severe symptoms such as pneumonia and breathing difficulties. It can rarely be fatal. I mean, this is on their website just as of today. I'm not sure what their definition of rare is, but if you told me I had a 1 in 50 chance of winning the lottery, I'm buying tickets all day long. Going on, question 9, can coronaviruses and the new coronavirus be transmitted from person to person? Yes, some coronaviruses will. Wait, what about this one? What about, no, some coronaviruses can be transmitted from person to person, usually after close contact with an infected patient. So that usually is the modifying word here. Usually after close contact. But, well, what do you mean usually? I mean, that's true, but are there other mechanisms? What about this airborne thing we've been hearing about? The coronavirus responsible for respiratory disease COVID-19 can also be transmitted from person to person through close contact with an infected case. That's it. That's all they talk about here. They don't talk about the possibility of airborne in this particular case, or even droplets. Close contact is really not sufficient language to be using here. Can new coronavirus infection be contracted from a case that has no symptoms, asymptomatic? According to currently available data, symptomatic people are the most frequent cause of virus spreading. Well, that might be true. I'm not sure. I haven't seen the data to support that, but I'll take their word for it if they want me to. WHO considers new coronavirus infection infrequent before symptoms develop. I don't know where they've got that data from. I'm going to have to hunt that down. I don't believe you can make that case. In fact, if I made that case, I would accuse myself of misinformation, because I think the Diamond Princess case, listen, all those people are locked in their rooms and it's a completely ineffective containment. How is that even remotely in alignment with telling people that the WHO still considers new coronavirus infection infrequent before symptoms develop, or that it must be passed from close contact with an infected case? At any rate, that's the kind of stuff we still see all around the world. In the treatment news, we're getting all kinds of good news on treatment. Lots of clinical studies out there. So this anti-malarial drug seems to be effective on COVID-19. I can't get any clinical data yet, that I haven't found any yet that says how effective it is, but these Chinese experts have confirmed that chloroquine phosphate, an anti-malarial drug, seems to have a certain curative effect on the novel coronavirus disease. So they're going to unanimously suggest that this drug be included in the next version of the treatment guidelines. So that's good news, because very cheap, very widely available drug. I don't know how effective, but it's good that they're starting to find things. That's fantastic. Remember, we talked about the plasma therapy, where they take plasma out of a cured or recovered patient, and it has the circulating antibodies. They separate out the platelets and the red blood from the plasma. They give the plasma to somebody. In this case, they gave it to this female patient in her 30s, and the hospital initiated the first plasma therapy in the country. So this is one of the first cases. To 9 critically ill patients, all received the treatment. And the good news is that this woman was discharged. So there's the train. She's healthy enough that she was able to be discharged. So that's good news as well. Also, it's very interesting to see this popping up. Kids are spared in this. This is in Science News. This came from February 14th. Very few infants seem to be getting sick with the new coronavirus. So they tallied, they looked at a new study that tallied all cases they could find of infants hospitalized with the virus in China from December 8th to February 6th. So that's a pretty big sample size. Found only 9. I mean, what do they have? 70? No, by February 6th, there would have been 40,000 cases across the country, and only 9 of those were children aged 1 to 11 months old. And of those, none developed severe complications from the disease. So it was very mild in children. Still don't know why this is, but worth examining. Now, not the flu, not the SARS, our big checklist. We're going to have to add a couple things. This no longer can we say 10x to 20x. We're going with 20x, might be as high as 50x. This is now something that the New York Times has figured out and put out there. So that's part of our understanding, including all these things as well. We're going to have to put down kids are spared. On my very, very first video on January 24th, I said, hey, we're going to expect this to hit the usual suspects. That would be the very young and the very old. We're going to have to take the very young off of that. It does not operate that way, although the flu does. You will hear about kids, young kids, especially infants, dying from the flu all the time. This is very different from that. So that's a good way that it's different, of course. I'm going to start collecting all of these drug treatments as well as a big list, because we're starting to find all these different things, and giving, of course, these antibiotics for the anti-pneumococcus and anti-staphylococcus stuff as prophylactically and defensively seems to be part of the treatment. So I'm just starting to collect this as well. All right, conclusions for today. Ex-China cases, they appear to be tracking an exponential increase the next few weeks. Really critical. We're going to have to watch that, of course, and we'll be doing that. When North Korea is doing a superior job relating the healthcare issues around a novel coronavirus than your country, I would submit your country's got a problem, and I'm talking about me here, but this applies to a number of other countries. Testing in the United States, many other countries, I think it's woefully inadequate to detect COVID-19, so I'm not all that comforted by the lack of new cases that have been presented. I've heard many anecdotes, and I've gotten emails from people saying, hey, I know somebody who had recent contact with somebody from China. They developed what looked like all the symptoms, and they weren't tested even after asking for it. That's a very common story that I've received so far. So if you haven't tested for it, how do you know if you've got it? Many countries, including that Italian case, still giving out really incomplete or even misleading information. Very unhelpful. I don't know how you come away from that website we went through it without being actually less well-informed rather than more well-informed. And early detection that leads to rapid quarantine, that is the only way to assure that your local hospitals do not get overrun. And that's the thing we all have an interest in seeing that it happens. The doctors and nurses don't want to have that happen. Your community doesn't want to have it happen. You don't want to have it happen. Nobody wants your local hospitals to get overrun. So, of course, you would want to make sure that you are testing and testing very aggressively and finding all the people who have got the disease and as well who they may have spread it to, and work very hard to isolate them in much the ways that China is doing right now and other countries as well. So with that, that's your update for today. Thank you so much for listening. We'll catch you next time.